artificial intelligence has arrived in a big way in healthcare. Currently, it represents an expensive technology that promises transformative improvements in efficiency and productivity, but reimbursement or payment models aren't established. In an era when we seek to constrain or decrease healthcare costs, who will pay becomes an important question. My name is Dr. Steve Peters. I'm a consultant in the Division of Pulmonary, Critical Care, Allergy, and Sleep Medicine at the Mayo Clinic in Rochester. The title of the article is Who Will Pay for Artificial Intelligence in Healthcare? Co-authored with my colleague, Dr. Shehzad Niazi from the Mayo Clinic in Florida. It will appear in the April 2026 edition of the Mayo Clinic Proceedings. This commentary tries to fill an educational gap and provide a practical reality check between AI excitement and hype on one hand and the fear of AI taking over or making mistakes on the other. Every day we hear about the swings in fortunes of major companies who might miss out on the AI boom or who have incurred huge debts as they build out data centers. Less has been said or written about how AI will be financed in healthcare and about coding and billing for technology in general. Will AI costs be reimbursed one billable service at a time as a subscription model, or will it become part of a bundled practice expense spread more widely? We know that current policies and methods for healthcare reimbursement in the US are complex. Into that complexity, we're introducing the broad term AI for applications that cover a wide range of methods, use different data sets, and have multiple outputs or potential clinical impact. The costs are high and could be absorbed as practice expense or might manifest as billable services for individual patients. We include several specific examples in the article. Payers, especially Medicare, aim to operate under budget neutrality. That is, if new payments are justified, the money might be shifted from other procedures or providers. While we don't think that AI will replace doctors anytime soon, some of the work, defined by relative value units or RVUs, could be decreased to allow for increased expense associated with the technology. Picture a series of radiology images or cardiology testing that comes with AI-augmented preliminary interpretation, assessment of severity, and probability of disease progression. If the practice expense for that software is reimbursed, the payer will ask how much effort was saved for the physician. As we point out in the commentary, this reevaluation of physician work will be controversial and emotional, and also inevitable. This will impact everyone. Mayo Clinic is relatively advanced in the application of AI into clinical practice. There are hundreds of algorithms running currently, expanded use of robotics, and early use of advanced decision support, with knowledge brought to the clinician in context for a specific patient. Clinical practice, as we have known it, is being altered irreversibly. Previously, a provider sat with a patient with available medical record information, their own knowledge, and if they had the time, some reference material. Now, any information in the patient's record can be succinctly summarized, curated, and even interpreted to suggest diagnoses and possible treatments. Further, existing medical knowledge can be brought to bear more or less automatically, again specific to this patient. Patients are already experiencing AI, though they may not always be aware of it. Their appointment might have been triaged and prioritized by an AI agent. Outside records are summarized in advance by a generative AI tool that can read notes, including scanned documents. Office visits can result in a clinical note generated by ambient listening. Their tests might return with AI-enabled interpretations. In-basket queries might be answered first by an AI chatbot. Links to additional information can be provided that are translated into easy-to-understand language, or for that matter, translated into any other language. The main goal for this commentary is awareness and education regarding current activities by institutions, payers, and government, anticipating the rapid expansion of AI in healthcare. This is not likely to be solved by passive neglect. Instead, we call for a prospective analysis and approach to make this exciting and transformative technology more broadly available. We hope that you will find it of interest.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.